Minister for Foreign Affairs, who is representing my brother, the President of Angola, who is in Kenya as we talk. And he will be having a state visit tomorrow. Fellow leaders, the great people of Kericho, distinguished Kenyans, members of the diplomatic corps, guests, ladies and gentlemen, watu wa Kericho, hamjambo tena. Kericho hamjambo. Kericho chamgei. Omune. Kericho Bwana Yesu asifiwe. Hebu mnisalimie hewani nione hivi watu wa Kericho. Asanteni sana. Mashujaa Day is a celebration of the power of individuals to change the course of history and the destiny of a nation. It is a reminder that nations are driven forward and changed by individuals, ordinary men and women who believe they can make a difference and who believe they can change the status quo. The status quo in 1963 was a colonial state, the denial of basic freedoms and dignity. Deep inside many individuals then, they believed change was necessary and they took action. Individuals belief resulted in action and ultimate progress that made us the people we are today, an independent, democratic, progressive. Our heroes are using their creativity to create. When we deploy, we are changing our country. This is our call to Ushujaa, to the best of us, to be our country, our nation forward into a destiny that we all share as a people. The Constitution guarantees Kenyans the right to the highest standards of health, the provision of a fully public financed primary health care, the installation of a digital health management facilities on this great universal health coverage that has been in the works for a long time. The government has instituted a paradigm shift to preventive and promotive health rather than where we've been at curative health. This approach also community health, financial viability and sustainability of community health is contingent on enhanced domestic resources for health. The national government is working closely with our county governments to strengthen the delivery of community health services through the payment of stipends for the 100,000 community health promoters. This will be done on a matching basis, 50% contributed by the national government and 50% contributed by the county governments. Up this fund so that to help us on the delivery in my office. We also agreed to provide the 100 community health promoters is used for service provision at the household level. And as you can see today, every community health promoter here present, each one of them has a health promoter's kit. And that is the case. Community health data is essential for the planning. Electronic community health information system, which is live and being used by the promoters across the country is as simple and its application will be used to collect real-time when they fall ill because they simply cannot afford it. Over the last decade, several measures have been put in place to enhance the capacity of the National Hospital Insurance Fund to effectively deliver on its mandate. While these reforms are based on the health needs of every Kenyan, we are implementing a per-household payment system where a flat rate applied previously and 55% of their earnings. On the other hand, those with a salary of 100,000 or more contributed 1,700, a mere 1.7% of their income. Astonishingly, even someone with monthly income of Kenya shillings 1 million, like William Ruto, the president, paid the same amount of 1,700, which translates to a paltry 0.17% of their substantial earnings, hamburgers and border, with respect to access to health. The Social Health Insurance Fund also signifies a shift to increased use of domestic resources for health financing, and a sustainable approach, especially control, has led to increasing fragmentation, poor service delivery, deteriorating health outcomes, and also insignificant transparency and accountability. The Facility Improvement Financing Act, the process and guide the country where public health facilities are able to retain their funds and have autonomy to operate their facilities based on their priorities. This will improve availability of resources at the facility to provide adequate and equitable quality health services, increase efficiency, and thus improve health outcomes for all Kenyans. Kenya has made significant strides towards digital transformation, with many sectors has made steady progress in digital technology transformation through implementation of digital solutions to manage and share and use data. However, the adoption of technology has been uncoordinated and characterized by fragmented implementation that have limited ability to exchange data. The Kenya Kwanza Manifesto identifies digitization as a pillar, efficient use of resources. The enactment and implementation of the Act and the digitization agenda will deliver on the promise to integrate ICT